So the coronavirus is spreading across the country. There are millions of Americans who are staying home, not spending Thanksgiving with their families. And there are millions and millions of more Americans who are frustrated and fed up with all of this. But there is some good news. There is some hope in sight. A vaccine rollout is likely just weeks away, according to Alex Azar, the Secretary of HHS. Here with me now is Dr. Atul Gawande. He's a member of the Biden-Harris Transition COVID-19 Advisory Board. Dr. Gawande, thank you so much for joining us. So I was talking about this with Governor Murphy a moment ago about the rollout, the actual logistics of getting this vaccine into people's arms. We heard from HHS today that we could see a vaccine, one of them, as soon as December 10th. What is that process going to look like? And how do you go from Donald Trump's administration starting it and Joe Biden's administration going forward with it?
Well, the good news is that not only do we have the vaccine, we have 3 of them that are showing great promising results. And so now the rollout is going to be crucial. But the transition has only just begun. The permission to begin talking to the agencies to learn what Operation Warp Speed has planned around distribution just came through yesterday, as you said. So we're still going to be learning in the days to come what some important information is. Here are some critical things to know. What are the current supplies that will be going out, to how much to which states and in what priorities? We know generally that healthcare workers and nursing homes are high on the list, and essential workers and people with chronic illnesses are in a high priority category. But exactly how much do we expect to go out? And what we know so far is it's going to be quite limited supplies. It might be 10 million out of 350 million people, maybe 20 million that can get access in the first month or so. So there's still a good ways to go to understand those things.
So the Biden team is, and you answered my next question, which was what questions will they be asking? So good on you for that. How is it going to work now that transition has started? When the Biden team is interacting with the HHS officials, CDC, FDA, everybody involved in this process, are they just being told, here's what's happening, or are they able to give any advice? Can they not start the actual working with them process until January 20th?
Yeah, there is a process where agency review teams, or small numbers of people that are put together from the Biden-Harris transition, will be speaking to the lead officials from each of the agencies, and in this case, in particular, Health and Human Services. There are lots of questions that the transition has that we as advisors have got to contribute to, and those will bring back information so that then the transition's implementation plans for what happens on January 20 can be coordinated. There's going to be crucial questions like, there was supposed to be 300 million doses that were the target for production. Why is it coming out at 30 million doses? And then where are the bottlenecks? Is it because of production? Is it because of money? Is it because of coordination? Then the Biden-Harris team can have the right plans in place for picking up the baton. That process has just started, and I'm confident now that we have some lead time that the teams are going to be far better prepared than they were otherwise going to be.
So we're up against the wall, but just another quick question. We have 3 vaccines, potentially all pretty successful. When do you expect enough Americans to be vaccinated to where we don't have to wear masks or we don't have to social distance any longer?
Well, both the Warp Speed director, Salawi, or chief scientist, and Dr. Fauci have said to the media that this is in the order of May or June where the majority of Americans would be vaccinated. And by then, that means really beginning to start returning to normal in summertime. That could mean people returning to everything from being able to go to restaurants and bars without restrictions in the same ways, being able to attend sporting events, et cetera. It'll be crucial to see how many people we get vaccinated and whether we get to that full level of immunity required to stop transmission completely. But sometime in late 2021, we will be there.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.